how do we determine what to adjust? So chiropractors can do a variety of things to determine which areas to adjust. We can take an x-ray, we can do an MRI, CT scan, we can use a ghost scope, a nerve scan. Basically, those diagnostic tools are ways to identify the subluxations in the spine. Another very, very valuable way to determine the subluxation is through palpation with our hands. You can really locate the subluxation through lack of mobility in the joint. Oftentimes it's multiple vertebra, like 2 or 3, 4 segments that are not moving properly. So by using our hands, we can feel that limited range of motion. We can feel edema, we can feel muscle spasms. So palpation, x-ray, MRI, those are very, very popular ways to determine which areas to adjust.
Is it the same adjustment as the last time? Do you adjust the same bones every time?
Okay, so when a patient comes in, usually these misalignments or structural problems have been developing for years. So the posture has changed. For example, instead of having the proper curve in the neck, the head has gone forward, so it's called hypolordosis. We need to do those segments over and over again to change that alignment, to change the posture it does require of that individual person. Everyone has different misalignments in their spine, but yes, we do adjust the same segment over and over again to retrain it to get in the correct position.
Are all patients adjusted the same way?
So when you go to chiropractic school, you are taught a technique. So every school teaches a different style or method to adjust. So we put people in positions to adjust their vertebra. And so it might look like we're doing the same thing to every person, but that's not actually true. For example, to adjust the lower back, because of the position of the lumbar facet joint, we oftentimes will put the person in side posture. That's how we're able to adjust those particular vertebrae, whether it's the hip joint, L5, L4, L3. Here in the thoracic spine, the facet joints lie different. So we adjust that area differently. And then here in the neck, again, the facet joints are more like this. And so again, we are adjusting differently. And then at my clinic, in our clinic specifically, we really focus on the posture. We want to improve the proper position of the neck, for example. We want the head to be back over the shoulders. We want the thoracic spine to come back. We want the pelvis to be level, and we want the lumbar spine to have the proper lordotic curve. So our offices really focus on these postural problems and put people on programs to correct or improve.
Does all adjustment produce that crack or popping sound?
Do all adjustments produce the cracking or popping sound? So the popping sound is air. Air molecules develop in our joint space. For example, our knee, our elbow, our fingers, our vertebra are the same. So air molecules, little bubbles, develop inside the joint. So when a chiropractor delivers a specific adjustment, you may hear a popping sound. A healthy spine should make a nice, healthy popping sound. It is not good, though, to get in the habit of doing it yourself. Constantly cracking your neck 5 to 10 times a day creates hypermobility in your joint, which over time leads to problems. It leads to arthritis, etc. So you want to do these spinal manipulations by a trained expert, and that's what a chiropractor does. I hope you guys enjoyed our questions this week. If you guys have any specific questions for me, please comment in the field below. You can find out all about our locations, our chiropractic centers in the link below, and information provided. So make sure you ask your questions below. I will sure to address them next week. Until then, guys, always remember, your health is your wealth.